Alrighty, I'm going to go ahead and introduce our panelists. Chris is the CEO of Freedom Healthworks and Freedom Doc, aimed at bringing transparency and trust back to the healthcare by giving physicians, providers, patients, and employers an alternative choice to the broken status quo. Chris also hosts the company podcast, Healthcare Americana, and leads the senior leadership team to drive innovation in the company and bring free market healthcare into the mainstream. And we also have Dr. David Cameron here, Chief Medical Officer of Hint Connect, Hint's very own curated national DPC network. He has been a practicing DPC doc for many years and has 20 plus years of experience practicing family medicine. Over the last decade, he's been a passionate advocate for the need to revolutionize primary care. And right now, we are really lucky to have him joining us as the CMO of Hint Connect. So without further ado, I am going to go over and turn this over to you, Dr. Cameron.
Great, thanks, G. And welcome. Looking forward to this conversation. We've got Chris Habig from Freedom Healthworks. Excited to have a conversation. We are going to talk about a good problem that we have. Many of you have seen the trends report that Hint Health puts out every year. And the Hint Trends report this year showed that direct primary care membership grew by 241% over the past 4 years. So interestingly enough, we're in the middle of a pandemic. Many fee-for-service practices contracted. For example, in 2020, the number of visits for fee-for-service went down by 10% that year. In direct primary care, in the midst of a pandemic, membership increased by 21%. Likewise, there are more DPC practices in the past 4 years, went up by 159%. But notice that the rate of memberships is going faster than the rate of practices. So somehow we need to be able to continue to keep up with the demand. There's more demand in the country, and more people are wanting direct primary care services, practices. But it's hard. It's difficult to set up your own practice. It's difficult to take a risk, set up a shingle, and hope that the patients show up. And so what we're going to be talking with Chris today is what supports are there for providers, for physicians, nurse practitioners, physicians assistants to be able to set up their own shingle. So first off, Chris, tell us about your background and why you formed this company.
Hey, Dr. Cameron, great to be here. We've had a wonderful longstanding partnership with Hint, and look forward to the future as you build out Hint Connect to really power additional membership growth in practices all over. Here at Freedom Healthworks, we believe that there's a supply problem. There's not enough practices utilizing this fantastic membership-based model around the country. My background is, my parents are physicians. I grew up in my dad's office, small town north of Indianapolis. The school bus would actually let me off at the entrance to the office every single day. And I got the sense that small town doctor, I thought that's what all physicians were like. I really did. And going through undergrad, wanting to be a physician, then I started, you start to shadow people, and you start to shadow physicians in hospitals and physicians in other settings. And you realize that my childhood, my experience growing up was the exception. It wasn't the rule. And I remember the day that I closed my MCAT study book because I never met a physician who said, "Hey, Chris, medical school is a good idea right now." This is 2008, 2009, not that long ago. Even my own parents said, "You know what, if I had a chance to go over and do it again, I wouldn't be a doctor." And it's very powerful to, a college kid who's like, wow, I thought this was kind of my path here. Just seeing the powerful influence and what a local trusted physician can bring to the community was very, very powerful. I mean, we walked into places and people knew Doc Habig and left and right, and he knew them. And I think that's what really set apart that experience from, what I had, to shadowing people, getting ready to, apply to medical schools. And I said, you know what, this isn't for me. These people look miserable. And so fast forward, a few years to about 2014, 2015, again, very much a family thing that my parents sat me down and said, you know what, we're done. And they were in their early 60s. And we're like, why? You've been doing this for 30 years in the same location. You know everybody. You're an institution here. People know you. And common complaints, they were working for an independent physician network that was getting bought out by Optum. And they said, this is dumb. This is stupid. Reimbursements are going down. Costs are going up. They had 6 full-time employees for every physician out there. And we said, well, why don't you just stop taking insurance if that's the crux of all the pain and the problems here? And they looked at me and said, I think that's illegal. And all of a sudden this light bulb came on, like, holy cow, I can use my entrepreneurship background, starting a lot of different companies in real estate and real estate investment, but all these being near and dear to medicine, to help physicians really take back control of healthcare. And that's what we set out to do, was empower physicians to build those relationships with patients. And that's where 1/5 of our economy is set, between the interaction between a physician and a patient. And it's important that you just take out every other roadblock out there, take out all the noise, take out all the waste, and get down to it. You have a physician caring for somebody in their community. And that is a very, very powerful force. And that's what we want to see continue to proliferate around the country.
What's interesting, how you were saying that there's a lot of people that were discouraging you from going into medicine. In my first 10 years doing fee-for-service primary care, I would not encourage others to go into medicine, or at least following my path. My kids, my son he's almost 16, and I don't think I would have said, hey, follow my footsteps and do the MCATs and go to med school. But the last 10 years of doing direct primary care has changed my perspective. And it's funny because my kids, they see me work, they see the fact that I enjoy my job, that I have professional satisfaction. I can come home, I'm involved in the kids' sports. And someone asked my son a few months ago and said, hey, what do you want to be when you grow up? And this is the first time I've ever heard him say this, but he said, I think I want to be a doctor. And I was like, really? And I was like, go for it. If he becomes a direct primary care doctor, I'd be so happy. But that being said, it's hard. Do you find, for people like my son that might be coming up and being DPC doctors, what are the obstacles that you see for people that are interested in going into direct primary care? What are the barriers? What are the obstacles that are preventing them from going in that direction?
There are a few of them that can be very costly in terms of money and time. I think a lot of physicians who go the kind of do-it-yourself route, there's a lot of them who are successful, and I am the biggest cheerleader. I'm saying, go do it. That's awesome. That's fantastic. You are successful. There's a lot of people who get themselves in trouble. And so, to take a step back, what we built at Freedom Healthworks was kind of a 3-part company. That one, we help physicians start out their own practices. We call that kind of our incubator hat. We help practices grow, we help them develop, and we help support those practices on more of a white label kind of back office management type of services. So we call that our accelerator. So we got an incubator, accelerator, and then we have our community where, our kind of one of our taglines we tell to people is that you're independent, you're not alone. And too many physicians are siloed out there where they're saying, I kind of miss that physician's lounge, if they even exist anymore, in a hospital setting, or the water cooler talk, or it's cool to have your own business, but gosh, this is lonely. And so we connect all of our clients together too across the country. As far as obstacles, most physicians have about 5 hours of business education through undergraduate school, medical school, and residency. 5 hours, 5 credit hours. That's not enough. There was a day when the independent physician was a very powerful force. I'm a living testimony to that, the story I just shared about my background growing up. That community physician, the old black bag making house calls, the old Norman Rockwell paintings where you have your physician and seeing the sick little girl, and the sick little girl wanted the doctor to put a stethoscope on the little doll's heart. That is so powerful. And we always say that medicine is the intersection of art and science. It's a practice, it's ongoing, you're learning new things. Most physicians peak in their late 50s, early 60s, which is about 10 years later than pretty much anybody else, any other career out there. So longevity is so important. And again, you're going to be learning things, you're going to be experiencing different things. And that goes into your whole picture when eventually you look at somebody and say, wow, Chris, you don't look very well, I need to see you tomorrow, ASAP in the office. Let's see what's going on with you. That is the epitome of the physician-patient relationship. As far as obstacles go, I mean, it's almost like everything from medical school to residency to employers discourage independent thought, independent leadership, and really independent practice. And that really frustrates me. There are medical schools out there who will say, "Oh, XYZ medical school doesn't create primary care doctors. We're specialists and surgeons," and there's all kinds of things. And I mentioned that, so from the beginning, they're almost like, "Oh, okay, you're going to go into the specialty because you go to this medical school, and by the way, you're just pretty much going to go work for this hospital, and that's pretty much it. Those are the only options you have." Once you see the light, and I know there's some people who are on this who have done it themselves, and hopefully everything went smooth, but there are a lot of people out there who would take advantage of physicians. We always joke about the physician's price from different people out there, but having a lack of business education, where do you find your accountants? Where do you find your vendor partnerships? Are you even getting a good price? There's a lot of noise out there, a lot of people who are saying, "Look, I'll build you a website for $15,000, and you're getting absolutely taken advantage of." So when I say obstacles, Dr. Cameron, what I really mean is there are impediments to success in any type of a business, let alone a very unique business model that is continuing to grow, but people might not have the complete picture of what this is. And you couple that with a business owner who might be more experimental in the different processes. And I disagree with the kind of mindset that if you build it, they will come. If you build it according to a very smart plan, and you keep expenses under control, and you invest in your marketing, you invest in your advertising, you know how to talk about it to people, then yeah, your likelihood of success increases dramatically.
Yeah, I can attest to that. In medical school, I got very little training. I got a little bit of business training from residency, but most of what I learned about running a business came through running a business and through doing, I took so many different courses afterwards because I knew I needed it. One of the things we start seeing are people that are already in the midst of running a business, and they're like, how do I now do it correctly? Do you start seeing some people that are saying, wait a minute, we're running into some problems. We've got an existing business, but here's our roadblocks. What do you see with that?
We do. It breaks my heart when we get a call that says, "Hey, I knew about Freedom Healthworks a year ago. I decided to go at my own route. Unfortunately, I have 20 patients. I've been seeing them. I have been in business for a year. I got 3 months of cash left. Can you help me?" And we can't. There's nothing to do at that point in time. And I think that is, in my mind, my biggest fear for this industry as a whole, is that physicians are doing it. They're doing it themselves, whether they got free advice or they look at Facebook walls or they read a book and say, "Oh, this is a nice little checklist. I'll just follow the checklist here." Any business is hard. Running a hot dog stand is difficult. And I don't think everybody can do it with just a checklist, let alone a medical practice that, is really caring for people. And like I said, it's really heartbreaking, because my fear is that those physicians will go out there and say, "You know what? I tried this whole DPC thing. It's not ready. It's all smoke and mirrors. There's no way. There's no hope for this profession. There's no hope to get better patient care," or anything along those lines. And that is blatantly just not true, based on everything you just said from, hence DPC trend report. This was the only model that actually delivered patient care during a pandemic. That was it. It was the only touch points where people could actually get care when they needed it. And that is very, very powerful. And so, just to recap that, like when I hear a physician was like, "Hey, I tried it. I didn't get there. I put a lot of money into the practice. I spent money in a lot of stupid ways." And there's no way to sugarcoat that whatsoever. So our process has been developed. We had 160 some steps, about 162, depending on what type of practice you want to install, whether you're kind of a pure startup, whether you're coming from employment, whether you're coming from kind of a transition practice before, if you're doing functional medicine, integrative, primary care, pediatrics, internal. There's a whole, kind of array of services that you can provide in kind of different avenues. And our company exists to help you push buttons, pull knobs, so that, if you are employed, you can step out, in 3 months, in 90 days, you can step out of your current employment. And then on a Friday, and then on Monday, you step right into your fully functioning practice, and we've pre-enrolled patients, and you're ready to rock and roll from day one.
Great. Well, before we get into all the services, and we're going to probably not go through all 162, but
No.
tell me a little bit about your experience where you've got a relationship with a practice that's doing fee for service, and they are really interested in direct primary care, and they want to convert their practice to direct primary care. What's your recommendation to kind of do halvesies and do a hybrid type practice where they do some fee for service and some DPC, or just rip the Band-Aid off and go 100% DPC?
I love that question. We love just the pure membership model. It's the simplest way to transition a practice into a membership based. Now I understand that might make some people chew on their fingernails saying, oh my gosh, I'm giving up my safety net of insurance or Medicare or whatever that is. We can do a phased rollout, but what I always caution people is we'll watch out for legal landmines when you do that, because that's really where you can run afoul of regulations, and make sure that you're differentiating services enough where your membership-based services do not drift. Your customer service is imperative. Your customer experience is the number one thing that will drive people into the door and keep people there. 3/4 of new patients come from word of mouth. That's it. There's no magic advertising campaign you can do besides provide awesome service and not be afraid to ask for referrals. If you're running a hybrid practice and you're giving great service to your membership people, are you going to walk out to your waiting room where somebody's been sitting there for 30 minutes or an hour or 2 hours watching people just go through the fast lane over here and present the same type of service to them? Or are you going to throttle back? And so what we find, just using that example, is a lot of physicians are like, you know what, I can't switch that on and off to provide services to my insurance patients that are completely different and I know are lacking compared to what I'm providing to my membership patients. So, kind of in recap, like, it's an easier business to run when it's not a hybrid model and it's just pure membership. It's much simpler from a legal standpoint, and psychologically from the physician standpoint, it's a lot easier for them to say, look, I'm going to go all in on membership, and the people that join me, I know that they're the ones who actually care, and they're not going to, try to take advantage of any of our policies, or that they actually want to become healthier and stay healthier too.
I also know that some people that are doing a hybrid practice, they feel torn, because in a fee for service, you got to be at a certain timeline in order to be able to see enough patients to be able to bring in enough revenue. Whereas in direct primary care, the revenue is separate from the amount of time per patient. And so as a result, you're kind of doing differential care. And it kind of causes a little cognitive dissonance.
Exactly. And you still have a massive overhead expense too, because you need those 3, 4, 5 full-time employees to make sure that you are getting top dollar from reimbursement on whatever contract you still have from an insurance standpoint. And anybody who's been involved in DPC, we know that's a very lean model. You need one full-time employee, and that's about it to get to about 500 patients. So a crushing overhead is, again, kind of going back to what you asked before, a giant overhead is a big obstacle and very expensive that we see will lead to a bad financial outcome is what I could say.
Okay, well, let's jump into the services. G, would you mind pulling up the slide deck so we can have a visual for this? Now, for those of you that haven't checked out the website, it's freedomhealthworks.com, and I was taking a look at it, and it's actually laid out very clearly in terms of the services and the pricing, and there's lots of transparency. But Chris, I'm going to have you kind of walk us through some of the services and the pricing that goes along with that.
Yeah, absolutely. And I love the fact that, thank you for the compliment on the website. The websites are always evolving. And all of our services and prices are listed out on our website. We have complete transparency because that's what we ask of our clients when we help them start a practice. We say, look, everything you're going to be charging, all your dollars, all your memberships are going to be posted online for people to understand it. And so I don't ever be accused of talking out of both sides of my mouth there. So we put all of our services and prices online as well. So just kind of quick slides. I don't want to take a ton of time on this stuff, but what we really try to show people is that working with Freedom Healthworks will maximize your medical brain, your medical knowledge, I always view doctors as kind of superheroes, local superheroes. They're the best and the brightest amongst us, and they're most caring. They actually care about other people. So, to empower them and put them in the best spot to be successful is really what our calling is. We work in about 27 states right now. We have 81 active clients right now. We've launched over 95 different practices. Through our launch vehicles, we have a pretty good standard set of services and steps to getting operational. Beyond that, we say, look, if you had a great experience and you need extra help, let us help you. If you can do it on your own, awesome. We'll be here when you need us. So like I said, we're big cheerleaders, big fans of the industry in general. What you see right there from what we do, I kind of mentioned that earlier in our talk right there. So incubator, accelerator, and then community is really what we call that, where we're able to link everybody together. And our goal is just to make your dream come true. We want to empower you to be the best physician you possibly can. A lot of conversations we have is say, well, what exactly does Freedom Healthworks provide me? And we say, well, we do pretty much everything besides be your local attorney. And we don't see patients. Our services end at the exam room. We do not interfere with your care philosophy at all. We do have a 100% success rate. I am very proud of that. Starting this company about 6 years ago, we have never had a practice that we started fail. I don't think anybody else can say that out there. There's no author, there's no checklist, there's no other program who can say that we have a complete 100% success rate throughout our history. Going down there to the blue slide, complete solution, direct care, startup, and support. So kind of talk about that. Like, what do we do? I mean, it's all these different things that go into running a successful business, from operations, financials, to marketing, management, services, analysis. We do have an academy that we call it our Freedom Doc Academy. What that is kind of the missing piece from medical school. We built that out to be the kind of business 101, an extension of all your business of your medical education, now with more of a business bent on it. Great, you've learned how to be a great physician. Now let's learn how to run a great practice. And so that's a lot what we really focus on throughout the startup is training and teaching. And you're working with our team throughout it again. So we don't just tell you what to do. We are in there teaching you why you're doing something, teaching you how to do something. And oh, by the way, you have my full team doing everything in the background, and it can be as involved as you want it to be. So we have a lot of physicians who are working full time, and they say, look, I'm working 8-10 hours a day. Can I just come home and just have kind of a list of action items and approvals, and that's it? And we say, yeah, absolutely. So it is a complete white glove service. It's more of a concierge startup service for direct primary care, or even sometimes, concierge medicine. Throughout that launch process, like I said, it's about 90 days. Some people use 180 days, and that's fine. We go on your pace. A lot of that depends on what your prior situation is from an employment or even a financial situation. As far as pricing goes, we charge $39,000 for this, for a practice that has incredible return and incredible return on investment potential. You could be seeing 500 patients at a full panel, within just a couple of years, depending on how quickly you want to grow, grossing over $350,000, $400,000 a year. So what we try to do is bring down the financial barriers to anybody starting a practice. From a traditional approach, this is what most clients use. We do have discounts for paid in full. If you just want to say, hey, look, I want to pay for the full startup process right away, great, that's $30,000. Or we can put in really a kind of a low cost installment plan over 3 years of your practice. We do have financing available. If you say, hey, I need a little loan and I've been having trouble getting a bank loan or whatever it is, we have a financing vehicle available for practices to take out what we call micro loans. We cap them at $100,000. No practice that we've ever worked with needed anywhere close to that amount of money to be profitable. Most of our practices are profitable with about 80 patients. Income replacement level, which is what they'd be earning at a hospital or employment, happens about 200, 250 patients. And then it just grows above that. So I would say the average practice all in amount, including startup, funding, furniture, medical equipment, as well as working capital to fund, kind of those growth months, is anywhere from about $20,000 to $60,000 on average before you're running a very profitable practice. And then coming soon, that third bullet point here, this is kind of fun. We're working to introduce a $0 startup for physicians looking to get into direct primary care. And I think that can be very powerful for new physicians just coming out of residency, for physicians who might not have the best credit score through consolidation of debt or whatever it is, or physicians who are sole breadwinners that say, look, I can't really have a big investment into my own practice. We're building out vehicles to be able to do that and rolling that out this year and next year nationwide. I mentioned that beyond startup, once your practice is open in about 90 to 180 days, we do have services that are completely optional. These are month-to-month services based around something as simple as, hey, we'll help you run your website and get your vendors partnerships up and going. That's our base bundle right there for $3.99 a month. We use our power-up services, as we call them. So we'll run all your books from your budgeting to your actual bookkeeping to your accounting to your taxes, as well as what we call a growth package, which helps really put into like supercharge the word of mouth marketing, and we'll help you manage some advertisements with some PR options, all that kind of fun stuff to help grow your practice. And then what kind of I view as our crown jewel, and this is what a lot of people are very, very interested in, more call center capabilities. So if you're a physician and you have this fear of selling your practice to prospects, we can handle that for you. My team has close to 80 conversations a day right now with prospects around the country, prospective patients around the country, asking the same questions that any other patient would who is being introduced to this model. Those questions are basically, I have Blue Cross Blue Shield. How does this work? Can I use my insurance? Can I see, how does your payment work? Are you accepting new patients? When's the earliest I can get in there? And so what we can do is save each physician about 15 to 20 minutes talking to that person, following up with them if they don't make a buying decision right away. And we're basically your inbound sales team on that accord. And that service has been incredibly valuable for all of our clients who's opted into it. And they're saying, oh my gosh, this is something that I'm not sure how we ever lived without. But it takes that fear of a sale out of it. And I know from experience that a lot of physicians might not be comfortable with that. And so what we're doing is building these services out in order to capture the next wave of doctors who might not be as entrepreneurial as some of those pioneers out there, and say, look, it's okay. We'll help you run your practice. You provide great medical care. You take care of your people. We'll help you take care of your business. And that's everything that is aimed at from these services, from launch, startup, and beyond it, to more of a practice management, more of a practice empowerment type of service level. So I know that was a lot. I talk quickly. I get excited about this type of stuff. But, going down to the next slide, why work with us? We have a proven solution. It works. It's effective. I wouldn't be here doing this if we didn't have something that I truly believe in, something that our clients truly believe in, and something that great partners like Hint also believe in. So there are good business people out there. I hope that our team gets put into that category as well, that want to see doctors back in charge of healthcare as a whole.
I'm going to dive into a little bit of the finances here. You've done a really nice job talking about what the potential startup cost might be, 20 to 60,000. I was thinking that was quite low. I chatted with quite a few people that spent much more than that. Mm-hmm. But you mentioned that getting to full of 500 patients, that you can see, depending on how fast people want to grow, a couple years. And you said break even was around 70 or 80 patients. How long to break even?
A couple of months. Usually a couple of months. We emphasize the pre-sales. And I think that's, again, what kind of sets us apart from somebody more the DIY approach, is that, about a month into your practice, we are hitting people up in the local community to say, all right, this is what it is. Let's start having information sessions. Let's start getting our clients out there. And it's a different story if you start with 0 patients versus starting with 100 patients. You start with 100 patients, you're cash flow positive from day one.
Right. Okay.
And that's very powerful, and that helps out from the pocketbook a lot.
You also mentioned replacement, so income replacement. and that's around 250 patients. What's your timeline estimate for the income? That's where you are not only paying your overhead, but you're also paying the same income that you received in your previous job. Is that right?
Yes.
Okay.
Yep.
What's the timeline for that?
Anywhere from, again, every situation is just a little bit different, but we see a lot of growth from anywhere from 15 to 20 patient growth a month is a good, healthy, sustainable growth rate. So just backtracking that, if you started with 0, you're growing at 15, you're growing at 20, you're looking about, early in the second year to mid of the second year to be able to have that income replacement level be achieved.
Okay. So it looks like you're mainly losing money for a couple months,
Mhm.
if at all.
Mhm.
And then you're going to be at least at break even to making some money for another year after that. And then after that, then it's gravy. So what is your recommendation for someone coming in that's afraid, like, oh my gosh, I've got kids that are going into college, or how do I make ends meet during that one, the first year and a quarter?
Some people approach it in different ways. We do have institutional lending capabilities that, what's nice about this is that they know this model, they know that it is effective. And so we can have great financial instruments from a loan capacity if you need that from a business point. They're not loaning you money at a high interest rate to go buy new cars, new boats. They understand this is a business loan. They understand the model. They understand the potential with it. I would also encourage physicians, if they're looking at this, see what you can live on. If I have conversations with physicians and they're saying, my bare minimum to live on is about 20 grand in income a month, I'm going to say, okay, well, make sure you sit down with your family. That's fine. We have some vehicles for you from a financial standpoint, or, like I mentioned, kind of that $0 startup that we're working on and will be coming very, very soon. But you have to be a very smart financial steward as well. I think there's a lot of people who get themselves in trouble because they go out and they spend a ton of money getting gold-plated faucets at their office and granite countertops, and they realize that nobody actually showed up because you didn't invest anything in marketing and advertising. So if you are out there and want to do the DIY approach, I would just say, put money into marketing and advertising in very smart ways. There's a lot of ways to blow money, so be very smart about it, but invest heavily in your marketing and advertising, and less so making it the prettiest office that you've ever seen.
And there may be some people that are saying, hey, I don't want to go in the red. So I want to, while things are slow, potentially slow, I want to do a side gig, do a side job. What would your recommendation be for the person that's thinking about doing some work on the side while they're building a practice? Is that a good recommendation or not such a good idea?
I would never want to get in the way of family finances or anything along those lines. If you're a physician and you need to have that supplemental income, great, do it. Go do what you got to do. There's a lot of really sweet medical directorships out there for private companies who are looking for options. There are long-term care facilities that we've partnered with to give physicians an option too. The big question there is kind of revolves around Medicare and opt-in status, opt-out status. So,
right.
If that scenario is you, then we can absolutely work with you in those first few months and then opt out of Medicare later. Just knowing that your membership might not be growing as much as it should be, because you are saying, look, I can only take people who are not Medicare eligible. And a lot of times those are the people that have the most disposable income in human history, that age group does. And not to mention that they really value a relationship with their physician. So there are pros and cons to both sides of that, Doc. There's no perfect answer. Everybody's situation is completely different. And my team is very sympathetic to that too. So we'll bend over backwards to make sure that you're in an environment where you can excel.
You may have touched on this a little bit, but I want to flesh it out a little bit more. I think there may be some people out there that are very interested in learning more about running a business. That say, hey, these are some great services. Maybe I want to tap into them for a little bit, but then maybe as I learn, maybe I might take those over. What resources, and you mentioned the community, but what resources are available for DPC practices that would like to learn more about running a practice and doing it themselves?
We have what we call our Freedom Doc Academy, open for all of our clients. And again, that's kind of a crash course. I kind of jokingly call it's the missing business hours that you never got back in medical school. That's a great place, to start. And so we put everybody through that, whether you are just saying, hey, I need some help negotiating with LabCorp. Great, we'll help you out do that. But by the way, here's our academy over here to run you through just some lesson plans and just kind of some business 101 type of lessons. And then, of course, you do have all of our phone numbers. So we have account managers active on every single client that you can pick up a call or shoot us a message, always monitored. And so we are always here as a resource too. And just depending how people learn, whether you are better just talking things out, kind of whiteboard sessions, or if you're better going through just kind of a lecture type of a learning series. We try to build something for everybody to hit all different learning styles and make sure that no one's sitting there saying, "Oh my gosh, I'm not really sure what revenue minus expenses equals. How do I read a profit and loss statement? What is my balance sheet? How much money did I actually spend?" One of my kind of favorite questions of, why do we need Freedom Healthworks is, okay, doc, tell me what your break-even number of patients is. And if they can't do that, then you know what? Let's figure out a way where we can build some financial credibility here, some financial literacy to make sure that the business can be profitable and they know what goals they have, regardless of whether or not they work with us. Again, like I say, I'm the biggest cheerleader in the world for this industry. And so I want to see it succeed. If people can be successful with us, awesome. If people don't need us and can be successful on their own, fantastic. I love it. I'll be your best friend in the world and have you onto our podcast and have you tell the world how you did it.
Yeah, well, great. Gee, I want to open things up for questions from the group. But while we're doing that, I just wanted to say thank you, Chris, because for many of us that have been in direct primary care for a while now, we were kind of in the midst of no support. Like there was, and as time is going on, there are more supports for running a practice. And I do foresee a time where more and more people with less business savvy, less business comfort are going to be able to enter into direct primary care because of the additional supports, and then people can be able to kind of figure out exactly what they need. So, hey, G, let me pass the microphone to you for questions from the community.
Sounds good. Thank you both for that really educational conversation here. We have some Q&A that come through. We have a two-part question from Dr. Stafford. First question, I believe, came up, Chris, when you were going over Freedom Healthworks services and pricing. She asked, what are the startup costs?
Yeah, it's a great question. Like I said, all of our prices and services are on our website there. From a startup standpoint, you can kind of choose your own adventure. We have a very popular payment plan that is $1,250 a month for 36 months, or you can pay in full. The list price is $39,000, but if you pay in full, then we discount that. We take $9,000 off, so it's $30,000, and then you have a brand new, sparkling, shiny practice coming out of it. And so again, that's just for the startup costs. And then if you say, great, let's continue to have support from Freedom Healthworks, then we kind of take our startup hat off and we put our ongoing services hat and support hat back on. And there's about 5 different packages you can choose from basic to growth accounting, as well as some virtual staff, virtual sales, and virtual clinical staff services that we provide. And then, just look at the second one. Seeing Medicare patients, I just want to be very clear about that because there's some different avenues that will work for some people, will not work for others. We do advocate opting out of Medicare so that you can see anybody and everybody and not be running afoul of any type of insurance contracts or government regulations. But some people, when they start off, they want to do more moonlighting. And a lot of those moonlighting opportunities require you to still be participating in Medicare. And if you so choose that route for the first few months as your patient panel is growing, then there's some just kind of tap dances we have to do around who can and cannot enroll in the practice, just because it's considered Medicare fraud to charge anybody less than what Medicare reimburses. And pretty much every DPC practice across the country will charge less than what Medicare practices. just because it's a very smart business model. And so we just be very careful about running afoul of any type of Medicare regulations.
Thank you for that. We also have two-part question from Dr. Rivera. First part, I see that number of the basic program and then a breakdown number. So those services are not included on the initial charge?
Right. So two different types of services. We have our startup and launch services, and then we have our kind of management and support services. So completely different, depending if you opt into those after your practice is already started. But I think that's the question being asked there.
Got it. Thank you. Are there any other questions from the audience? Feel free to type it into our Q&A box. And also, if you raise your hand, I can also unmute you so you are able to engage in real time.
One question here, it says, to clarify, you cannot use the itemized services if you don't belong. Is that referring to the basic service plan? Not quite sure what that question's getting at. Does that
I mean
anything to you, Chris?
In general, if you want to take advantage of those services, then there is a cost to those, just like anybody seeing a patient. They got to join your practice for you to take care of them. Very similar type of concept.
Okay. When is the best time to start up a direct primary care? Straight out of residency, or would you recommend people get a little experience under their belt? When have you've had 100% success, so I guess any time is a good time, right? But what are your thoughts?
I love it when the young docs get involved. I really do. For some reason, a lot of our growth from our clients come from physicians in their mid-30s or so who have worked for a hospital for a couple of years and realized this isn't what I signed up to do. And so those physicians do really well because they're hungry. They know why they became a physician. They don't have kind of that addiction to salary yet. Again, it totally depends on their family situation, and some of them need a couple more years to earn kind of a nest egg to be able to invest in the business. We also see a lot of mid-career physicians who are just so tired of being on the hamster wheel every day. And it's either go this route or leave medicine entirely. And that, again, is very, very heartbreaking. Then we have physicians who are later in their careers, and they look at this as a way to extend their career without overworking themselves. And what's really cool about that is that they know their practices have more of a residual value. And so it isn't just, hey, I decided to retire. Now I'm just going to put a chain on my doors and that's it. It is, let me bring on more of an apprentice type of a program for somebody coming out of residency who might not say, I don't quite have the experience to be independent right now. So I would actually like to learn from somebody who's been doing it for 35 years. Those types of programs are happening right now with our practices. And that's a lot of fun too, to see, a 70-year-old physician mentoring somebody in their 30s and being introduced and eventually being able to buy that practice out and provide a great little retirement nest egg for that physician as well. So they're all over the place. It's kind of the right answer for that. There's no right time besides as soon as possible. As soon as you are comfortable, as soon as you are ready to do it, that is the best time. And you got to believe in yourself. I think that's one of the biggest factors of failure, is that somebody isn't prepared mentally to talk about their practice and say why they did that. A lot of physicians want to make it about themselves, and you cannot do that. You have to make it about the patient. I'm doing this to enable patient care and take care of my community. And we see some physicians who are very apologetic about that because they think they should apologize for not seeing 2,500 patients anymore and only limiting their panel to 500 people who actually value their care. So, I don't want anybody to be apologetic. You are physicians, you are smart people. There is time that you stop working yourselves to death. And I sincerely mean that.
I've chatted with this one doc who was right out of residency, and he was thinking about going in direct primary care, but he felt there were two things that held him back. The first was he felt like he needed more experience, like he needed to see more volume of patients. And the other thing is he was worried about going and being by himself. And those were two things. And so he went into He went into worked at a community health center for a couple of years, and I said, hey, well, we'll just touch base in a couple years. And sure enough, after 2 years, he's like, I'm ready for DPC. He's like,
Can't do it anymore. Yep.
Had enough already. And you know what? I like the fact that you've got a community, because being in direct primary care can be a bit lonely, and especially if you're in solo practice. And I know that there's more and more kind of there's employment models, there's groups that are starting to form, there's networks, lots of opportunities, so that you're not so alone, and that you have people that you can run questions by, people that you can share call with. There's a lot of things that are nice about being a part of a group. And so I think over time it'll be easier and easier to take that leap. I think going into direct primary care oftentimes is daunting because of the financial implications, how to run a practice. There's just uncertainty. But my hope is that as time goes on, more and more people will feel more comfortable taking that step. And I don't think it's a leap of faith. I think it's just taking a step and having the courage to do so. I mean, I think it is the thing that makes all the difference.
I completely agree with you. I kind of bristle when someone says, "Oh, I took this kind of blind leap of faith out here," and I said, "Well, it doesn't have to be a blind leap of faith. You can work with organizations that have very curated steps, and you take one step right after another, and you keep putting left, right, left, right, left, right, and you will get your goal in a very smart, cost-effective way."
Yeah,
there's a lot of people that want to see this succeed. As an industry, there's a lot of people out there that are saying, you know what, it is time that physicians take back what they should rightfully have never given up, and patients need that care, communities need that care, and there's no argument behind that, and it's an incredible motivational force. It really, really is.
Yeah. Well, now we're getting on our soapbox. I mean, I must say, I think if we're going to transform how healthcare is delivered in the United States, it's got to go from a grassroots movement where physicians and nurse practitioners, physician assistants decide to say, hey, this is our business, and start delivering high quality care in a way that delivers excellent customer satisfaction. And by delivering great primary care, we decrease those downstream costs, and it's less expensive for the patient, for an employer if it's an employer situation. Insurance companies benefit from it because there's less downstream costs, and so will large institutions like even CMS. So now we're definitely getting pie in the sky, fun stuff, but this is what gets me up in the morning. So, Chris, really enjoyed the conversation today. Have a wonderful day. G, thank you for all of your assistance in making this happen. Is there anything else we need to do before we adjourn?
I don't believe so. What I will do is I'll send out the PDF to everyone that has attended and registered, so that way you can get in touch with Chris if you have any follow-up questions.
All right. Have a great day, everybody.
Thank you so much.